Nick was born a girl, but even as a child felt something wasn't right.
I had always wanted to be a boy. I had gone to sleep at night, hoping the next morning I would wake up and be a boy.
Rebecca was born a boy, and she too felt uncomfortable in her own body.
I say that I have memories probably as far back as about 5 or 6 years old, where I felt like something was off, and that something was not, I wasn't experiencing the same things that boys my age were.
Both Nick and Rebecca are transitioning into the gender they have always felt they were meant to be. Both have opted for surgery. Gender reassignment surgery made headlines earlier this year when Bruce Jenner became Caitlyn Jenner. Well, we wanted to go beyond the headlines and find out exactly what happens to the body during surgery and talk about the psychological risks that haven't made news.
It involves everything from the face to the torso to the genitals.
I see broad shoulders. I see good pectoralis definition.
Dr. Naveen Singh is the surgeon for both Nick and Rebecca.
I prefer not to think of it as gender reassignment. It's getting them their correct gender, the gender that they've felt all along in their own heart of hearts, and oftentimes that their family has felt is their appropriate gender. So it's gender confirmation.
The physical transformation is done in a series of surgeries. The face comes first. For a woman transitioning into a man, Dr. Singh may do an implant on the nasal bridge to make the nose stronger, may do fillers around the cheek and jaw to create a heaviness. He uses liposuction to remove breast tissue and to reduce hips and define the arms. That completes what's called top surgery. Genital surgery or bottom surgery is the final irreversible step.
Those women that have been on testosterone, their clitoris will hypertrophy, meaning get larger.
For a man transitioning into a woman, Dr. Singh may do a nose job to make it smaller, do a bone graft on the brow bone to soften the face, also shave down the chin. The final step for top surgery is breast implants. The bottom surgery is very involved, removing most of the genitals and creating a clitoris and vagina. Dr. Singh says patients do have sexual gratification, but not in the traditional sense.
Certainly, although it's gone well for many folks, and we want to acknowledge that, there have been many cases where it hasn't gone well, people don't pass very well, they don't get the outcome they'd hoped for.
Dr. Fred Berlin is a psychiatrist at Johns Hopkins Hospital. He cautions studies show the suicide rate is notably higher among those who have had gender reassignment surgery.
18 times more than the general population committed suicide. That all has to be known ahead of time before making a very big decision, such as removing normal anatomy with the expectation of happiness, when indeed in many cases that happiness isn't going to be there.
Like many patients, both Nick and Rebecca have opted for top surgery only at this time. Both say they have been through the proper counseling and are ready for this major step in their lives. Mindy Becerra, WBAL TV 11 News.
And there's a link on our website, WBALTV.com, to the study that Dr. Berlin spoke about. Be sure to click on Medical Alert.